of the issue is corruption, because medicine has to do with money. And it's not just a perception. In certain countries, in certain territories, in the market, I don't know that some people imported and the price, they are even happy that procurement will take place so that there will be shortage. But at least I do know of one or two companies. Put it this way, Rob asked, he just said that I'm not happy about the quality of a product.
WHO likes about Meta and is fond of talking about it, that it is a comprehensive approach, that is looking at the slide in here. Two slides. So those that I forgot to mention was that
one-third of world's populations lacks access to essential medicine. This one you can take from WHO reports on medicine strategy 2004-2007. And I think I want to encourage you to go to the internet. Now that you have been introduced to Meta, you will be able to an essential medicine access. There is more information on the internet, and you have to update yourself because medicine is dynamic. There are changes every day. And pharmaceuticals are the largest health sector expenditure after personal cost. After the government pays salaries to the workers, the expenditure on drugs is the second largest, and especially in most low-income countries, and can constitute up to 50 to 90% of out-of-pocket spending on health for poor households. We know that. We have families back in the villages, and sometimes you get a call that someone is on admission and they need money for the person for the medicine. And improving the availability and affordability of quality essential medicine is therefore the key to increasing access to health care. But however, you have seen that the nature of medicine sales is difficult, sometimes it's unclear. And medicine sales and distribution contributes to high levels of inefficiency and fraud. It includes bribery, theft, and diversion, also the supply of counterfeit and substandard medicine. And also there is some practice in Ghana. It is like rent-seeking behavior, such as the addition of unnecessarily high markups at different points along the supply chain. This increases the cost of quality medicine and reduces their availability, undermining health services and outcome. It also harms those that supply medicine and other health-related goods and services, increasing their operational costs, reducing their competitiveness, and damaging their reputation. But increased transparency and consumer participation in procurement can help cut corruption, improve efficiency, and increase value for money. Mr. Chairman, this workshop is a part of civil society capacity strengthening as part of work of International Medicine Transparency Alliance, or META. And then it has been mentioned that META has been launched as global alliance with pilots in 7 countries. And these countries have recognized that increased transparency in medicine sales and distribution will help them to challenge corruption, inappropriate markups, and prevalence on counterfeit and other substandard drugs. A first step would be a commitment, and it has been shown. Ghana was able in last November to launch the initiative at high political level to prioritize the issue, and global and national activities facilitated by META would include supporting countries to undertake full medicine pricing and availability surveys, encouraging the use of follow-up survey methodologies for regular monitoring of medicine prices and availability, publicizing widely this and other data on prices paid at various points along the supply chain, including those agreed at public tender, scrutinizing this alongside all data on stock volumes and availability of medicine to the consumer, facilitating agreements by pharmaceutical companies, global and domestic, to publicize their supply prices. And I think during the workshop you will be taken through the activities that META will facilitate. There are a number of them. What we have to understand that META aims to use multi-stakeholder approach. It's not just one person. It's not a civil society organization alone. And this approach towards increasing transparency around the regulation, selection, procurement, sale, distribution, and use of medicine in developing countries, and in Ghana in particular, thereby strengthening governance, encouraging responsible business practices, and the last outcome that we are expecting, that it will be improved access to medicine, especially to the poor. I had something to present, but it has been mentioned already, but I just want to challenge you. Back in 2001, 2002, this is from personal experience, I was working at our government hospital, and it was the first hospital who started the antiretroviral therapy. We started with prevention of mother-to-child transmission. And I knew that antiretroviral drugs, they are costly. For the month's treatment, it will be more than $100 per person. And then I knew the people that are staying at that area, their income. So I was wondering, we will start this process, but the people, will they be able to procure the drugs? And then I was thinking, what will government do? And then, fortunately, government was able to subsidize. So I see that as civil society organization, you should play an advocacy role, because you are on the ground. Maybe new initiative will come, or new drugs will come, and then you know that there's no capacity of the person to procure. Now the drugs is highly subsidized. The person is required to pay, I think, 5 Ghana cedi per month. But believe me, there are still some people, they cannot even afford that 5 Ghana cedi. So some, like for my district, NGO comes in and they pay that 5 Ghana cedi. Then also another issue, I was doing my research at New Jabe, not New Jabe, in Ashanti region, Ejisu Jaben district. And I was looking at the feasibility, it was 2003, I was looking on feasibility of introducing HIV testing. They were calling VCT, voluntary counseling and testing. Now we have removed V because there's no more voluntary, it's CT. And during my research, I saw that majority of people, they say that it should be free. But when the program started, it was just 50 pesos. It's very small, but even in working in my district in Asajaman here, we organize a debate, we organize campaign, but people are not able to pay even a 50 pesos. And later on this year, we received a directive from the Minister of Health that all HIV testing should be done free. So, and you are, once again, you are staying with the community. So if you see such developments, then you have to raise your voice and then add your voices together. And then come and then maybe do the advocacy meeting and then advise the government on some of the challenges will be done. Another example, with inception of national health insurance. When we look at, it has inclusion and exclusion, some of the services. I noticed that family planning, it's not covered by the health insurance. And looking at the family planning coverage in my district, I knew that it won't work. Because although family planning communities already, they are highly subsidized by the government. All the same, even for some pay 1,000 or maybe 10 pesos, they are not able to afford. So always at the meetings, I'll raise my voice that family planning should be added, should be covered by the national health insurance. Because if the woman is not able to protect herself, she will end up at my hospital with septic abortion or maybe with others, while she could have access to family planning under health insurance. Concerning malaria drugs, recently I read from the internet, I think it was published on the 17th of April, that Global Fund wants to put some mechanism in place whereby, our wonder drugs, chloroquine, has failed us some few years back. And we have to, and that time, chloroquine costed us old 1 Ghana cedi, isn't it? The blister pack, even the loose one, it was much cheaper. So, and then we have to go for the artesunate amodiaquine combination therapy. And it was 20 or 30 times higher. So we were asking how the people will be able to pay in the villages. Fortunately, health insurance took care of that. But still, I have around 40% of my community members, they are not covered by the health insurance. So when they are coming to the treatment of malaria, it costs. It takes money from their pocket.